sounding loud, right on the peace train. Whoa, peace train, come on now, peace train, holy roller. Everyone jump on the peace train. Oh, come on, peace train. Get your bags together, go and bring your friends too, because it's getting nearer, it soon will be with you. Come and join the living.
Okay, Savina, you can start when you're ready.
Thank you, Carl. Good evening, and thank you for joining this Fun Healthcare, Not Warfare webinar. I'm Savina Martin, a coordinator of the Massachusetts Poor People's Campaign, a national call for moral revival, and I'll be your moderator. Across the state, hundreds of thousands of healthcare workers, low-wage earners, tenants, and small business are under great stress and direct danger, desperately in need of increased resources, investment, and income. This Sunday evening, we are focusing on the unequal impact of the pandemic on Black, Latino, and immigrant populations. There are many reasons for the national failure to be prepared for this pandemic, but one thing that we want to call your attention to is the diversion, year after year, of more than half our tax dollars to foreign wars, nuclear weapons, and shoring up reactionary regimes. We think it's time to cut the war budget and invest our tax dollars in public health and public welfare. Fun healthcare, not warfare. After our program, we will have a petition for you to sign. In the Poor People's Campaign, we have called attention to the COVID-19 pandemic. It has forced us into an unprecedented national emergency. This emergency, however, results from a deeper and much longer term crisis, that of poverty and inequality, and of a society that ignores the needs of 140 million people who are poor or who have or are $400 emergency away from being poor. In 2018, for example, we released the Moral Agenda and Declaration of Fundamental Rights. The document presents a comprehensive response to racism, systemic racism, poverty, ecological devastation, militarism, and war economy plaguing our country today. In addition, in June of 2019, we held in Washington, D.C., a Poor People's Congress, and released, along with the Center for Policy Studies, an extensive document entitled The Poor People's Moral Budget. It outlines in 7 sections of the moral budget a look at politics and investments for 7 critical areas of the poor people's moral agenda. 1, democracy and equal protection under the law. 2, domestic tranquility. 3, peace and the common defense. 4, life and health. 5, the planet. 6, our future. And 7, an equitable economy. In each case, we found that our nation has abundant resources to meet the demands of the poor and to address the widespread and systemic injustices we face. So this June 20th, 2020, between the primaries and the general election, we are rising together for a mass Poor People's Assembly, one of the largest digital justice gatherings in history. This is the 4th in the Fun Healthcare Not Warfare series, co-sponsored by Mass Peace Action, Mass Poor People's Campaign, Our Revolution, Massachusetts, Progressive Democrats of America, Citizens for Public Schools, and Cambridge Residents Alliance. Special thanks to Rosemary King, co-chair of Mass Peace Action and Organizing the Planet. This evening, we will hear from Marcelle Grair of SEIU 509 about SEIU organizing. We'll hear from Kevin Peterson on the COVID-19 town hall discussions of leaders and activists in Boston's Black community. We'll get another perspective on our public health crisis from city officials in Boston and Holyoke. Boston City Councilor Andrea Campbell, Marty Martinez, Chief of Mayor Walsh's Office of Health and Human Services, and lastly, Alex Morse, Mayor of Holyoke. We will start off with Marcelle.
Great. Thank you, Savina, and good evening, everyone. Thank you to all the organizations that took the time to put this webinar together. Hello to my mom and sister as well, who I see in the participant list. Thank you for always supporting me so much. So I'm going to share my screen really quickly and go through just a couple of slides around SEIU 509. So right now, we are in a really important moment for union organizing, and I'm going to go through what we've been doing so far as an organization. Just a couple of seconds though before I go into that, I want to just acknowledge my family's labor, which is a wide range of different types of workers, mostly blue collar workers, past and present, who really show what it means to have an intersection between race and class. So just want to honor my family's labor, especially folks in my family who are continuing to do frontline and essential work that's always been important, but just want to make sure to uplift them tonight as they're doing important work all over the country. So who is SEIU 509? Some folks may have heard of this organization before, but it stands for Service Employees International Union, and we have close to 20,000 members across Massachusetts. We do a lot of social service work, supporting folks who are at risk, elders, folks with developmental disabilities, as well as mental illnesses, as well as we have members at 6 different universities in Greater Boston. We're also fighting for the common good and not only trying to fight for good contracts and stronger working conditions, but also just in general raising the living standards and the types of services and the quality of services that we're providing. And then we're affiliated with a larger organization, a national union that is growing pretty quickly in our organizing. So just wanted to point out, since we are talking about racial inequities tonight, what the workforce in Massachusetts looks like. If you take a look at this graph here in the blue, this is Massachusetts workforce total. The orange would be workers who are in the social assistance field, which ranges from family child care providers to group home workers to social workers and so on. And then in the gray area, which we're doing most of our organizing right now in this area, would be folks who work at residential homes, so mental health group homes, as well as developmental disability group homes. And you'll notice that, for example, if we look at Black folks in Massachusetts, 9% of the workforce in Massachusetts, but 31% of the workforce when it comes to this residential subsector, which is one reason why we really want to organize this industry, because a lot of people of color are employed in this human service industry, especially in the residential subsector of that. The next slide, you'll see that there is a huge pay disparity when it comes to the residential subsector, with folks who are white workers earning 20% more than those who identify as Black or multiracial. So you'll see that in this graph that shows 2016, 2017, and 2018. So really tackling this industry and organizing this industry also addresses the pay disparity of these healthcare human service providers that we're organizing. So to get to our new organizing, what we're doing right now, so whenever new organizing is used, we're just referring to workers who are coming together for the first time to form a union, who don't have a contract. As we're approaching COVID organizing right now, it's intersectional because we're addressing worker justice, racial justice, disability justice, and so on. Many of our organizing efforts right now, we're organizing with folks who don't have a union yet, but we're trying to do things across the sector. So demanding things around hazard pay, PPE, deep cleaning at group homes, and so on, and trying to do that across the sector. And for folks who aren't familiar with the human service industry as much, workers are facing low wages, unstable scheduling, staffing issues, which ultimately impacts the type of services clients can receive, high turnover, and so on. So right now, during this pandemic, we've really had to make a huge shift to digital organizing, which a lot of organizations are doing, which brings opportunities and challenges since organizing is really something that you would like to do in person. But right now, during this pandemic, we've been, of course, using social media, Zoom, and so on to really bring these narratives to the public and to support workers trying to form a union. So lastly, just wanted to give some action items for folks who want to learn more about how we're approaching our organizing and how to support workers who are supporting folks with disabilities, who are supporting workers at or clients at mental health homes and so on. So we have a couple of ways for folks to get involved. For one, following us on social media on Facebook and Twitter. It's both at SEIU 509. We're continuing to support folks trying to win a union, and one way we can do this well right now is community folks can support us by signing a petition. You can make a phone call, doing car actions and such like that. So if you want to know the type of things that you can do to support workers and be updated regularly, you can follow this link, which I'll put in the chat box, to really support workers who are continuing to organize to form a union. And then lastly, we are really prioritizing organizing in this industry right now because racial justice is a main pillar of our union. And so if you know anyone who works in the Human Service Agency, which is really, it's a wide industry in Massachusetts, please feel free to share their my email with them so they can follow up with us and connect and learn what are the steps to forming a union, how do I build an organizing committee, what have folks been able to win who have a union, and we'd love to touch base with them. So I'm going to stop there because I know there are other speakers this evening, but I will drop this information in the chat box and look forward to working with folks and protecting human service providers right now.
Thank you, Marcelle. Our next speaker is Kevin Peterson.
I'm there. I'm here. Thank you. Thank you, Savina, for your moderation, your moderating. Thank Peace Action for the invitation tonight. I'm certainly honored to be included in the voices that have been presented over the last few weeks about this issue. America will never be the same again, but how we respond to this crisis, this pandemic, is critical. And so the work that Mass Peace Action is committed to in terms of highlighting issues and raising concerns is critical for our future, particularly the future of the Black community. I've been thinking about the COVID-19 pandemic for a number of weeks now in a very intense way, particularly as it's impacted Boston's Black community. Indeed, COVID-19 has hit this community with devastating impact. In fact, the virus has disproportionately infected the Black community, not only locally, but nationally. All across the country, from Brooklyn to Baltimore, from New Orleans to North Chicago, the plague lingers. It is as if the very presence of death walks the streets to settle upon the weak, the weary, the despised, the dispirited, the disdained citizens of our nation who also happen to be poor and Black. At 2 virtual town hall meetings hosted by the New Democracy Coalition last month, some of Boston's Black leaders gathered to discuss the impact of COVID-19. Under consideration was this painful fact. Blacks make up 28% of Boston's population, yet they are 42% of city residents who have either died or contracted COVID-19. During the town hall meetings, these leaders pondered the reality of this crisis, a crisis wherein the very fabric of a community is seemingly being ripped asunder, where families are being forced to confront the cold consequences of death, where individuals who have contracted the virus are being forced into stages of anguish and anxiety, anger and agitation, about which they have no clue of recovery given the fact that they suffer pre-existing ailments like diabetes or asthma or high blood pressure. What the Black leaders at the town hall meetings were clear about was that racial division in Boston is stark and unforgiving. Life in the city for Blacks is, as the philosopher John Locke has said, nasty, brutish, and short. What those leaders were also collectively clear about was that it is imperative that they address the stark racial divide, the 2 Bostons, 1 white, 1 Black. COVID-19 exposed the ugly, repulsive, unsavory underbelly of civic life in Boston. This exposure was not unlike what activists, who for the last 2 years were seeking to reveal about Faneuil Hall and why its name must be changed in order to foster public repentance, reconciliation, and racial repair. Indeed, Faneuil Hall, built by slaver and now owned by the city, stands as an anti-Black metaphor in Boston. These activists have been trying to say, for instance, that it's problematic that the average net worth of a Black family is $8 compared to $287,000 for a white family. They have been trying to say that Boston is the 3rd most segregated city in the nation. They have been trying to say that the high school dropout rate for Black students against the achievement of white students is too dramatic. They've been trying to say that a young Black girl born in Mattapan 10 years ago is more likely to live in poverty than her white counterpart in West Roxbury. In some strange way, COVID-19 has given testament to what those activists have been trying to say about the harsh racial gap that exists in our city. It is against the backdrop of all this that the participants, the leaders in the Black community in these town hall meetings were in concert about 3 things. First, they said a return to pre-COVID-19 conditions in Boston's Black community is undesirable and patently immoral. A return to prior realities of broad-based inequity and civic unevenness represents moving back into the demonstrably repulsive precincts of alienation that have historically plagued their community. Secondly, those leaders were insistent that the redevelopment of new social norms is desirable. This might also be called a need for a new social contract within these neighborhoods. However we phrase it, these leaders concluded that a reconstruction of civil society within Boston's Black community was vital to its civic health in the short and the long term. This redevelopment of civil society is tantamount to fostering Black-led reorganization and the adoption of new strategic priorities within Black neighborhoods. This clearly summons a will to examine the internal functionality of its own institutions in order to gauge their capacity to effectively lead and serve a desperate community. This will necessitate what Roberta Unger has called formulating credible alternatives to the present and past material, aesthetic, and spiritual conditions within an already fragile community. This will require reimagining central sacred institutions and civic arrangements like the Black Church, civil rights organizations, and existing familial formations. Nothing short of an exhaustive reevaluation of its past incapacities and its present capabilities should be expected in order for the Black community to functionally survive in a post-COVID-19 era. Third, because the goal of Reconstruction of Boston's Black community is grounded in the concept of civic engagement, the city's Black leadership must engage in deep dialogue about what this means in specific terms and actualities. This dialogue may likely go beyond simply voting or the dimensions of electoral representations and leadership. This dialogue may well call for avoiding traditional politics in favor of a meta-politics that directly takes up the task of how we ensure human flourishing for all, not only for the tiny minority of Black elites in Boston. They indeed may require institutionalizing new relationships with local, state, and national governments that point towards systemic repair to longstanding inequality and social repression based on race. They may require pragmatic responses to what Harvard professor Sidney Verber has called deep structured participation. And this will require theory work on the deepest level regarding what Robert Putnam means about building social capital. The COVID-19 pandemic has provided an opportunity for hope in Black Boston, hope for a reconstructive community, hope for reimagining its internal institutions, hope towards racial repair and reconciliation in our city, hope for systemic redress and answering the city's original sin of imposed segregation and racial animus. This is what those leaders at the town hall meetings were leading toward with all sincerity and hope. And perhaps embedded in the hope of these Black leaders is what the abolitionist Frederick Douglass has intoned: those who profess to favor freedom and yet depreciate agitation are people who want crops without plowing the ground. They want rain without thunder and lightning. They want the ocean without the roar of its many waters. Thank you.
Kevin, thank you very much for those words. Thank you. And next we are going to hear from Boston City Councilor, Andrea Campbell.
Thank you, Savina, and thank you for saying my name correctly. I appreciate that. Thank you also, Cole, for the technical assistance, and of course to the Massachusetts Peace Action and Dorchester People for Peace for the invitation. I also, of course, want to thank my panelists who are doing the hard work every single day, whether in government or in their respective institutions, to not only address the issues that have come up because of COVID-19, but of course the hard work of supporting communities of color before COVID-19. This is not easy work, so I appreciate being a part of this panel with all of you. I'm obviously in the Boston City Councilor for District 4, and that includes Dorchester, Mattapan, which are my biggest neighborhoods, a little bit of Jamaica Plain and Rosendale. I'm on my third year my third term, my fifth year on the council. And of course I serve with some incredible colleagues. We have now our most diverse council in the history of the city of Boston. And everyone, of course, is having a positive impact on these conversations. And last year was blessed to serve as council president and the first Black woman to serve as council president. And while of course it was an incredible honor, the fact that I was the first says we have a long way to go. You know, COVID-19, we all have obviously been experiencing this for months now, and is affecting all of us in different ways. But the data is definitely clear, and I think Kevin summed it up well, and I'm sure Chief Martinez will speak to the actual data points, disproportionately affecting communities of color, and then on top of that, disproportionately affecting Black people. Okay, my 2-year-old son, so if he's saying something, come over here if you like.
My TV.
Okay, I'll turn mine down and you can turn yours up. God bless my 2-year-old, that's Alexander. And so my district is predominantly a district of color. It is one of the poorest in the city of Boston. It has the highest percentage, or one of the highest percentages of Black residents in the city. And so people, of course, behind those statistics that Chief Martinez will go through, they're not only my residents, voters, constituents, they're friends and their neighbors. And the calls have only gotten worse for my team and I, in that we are seeing more folks die from this pandemic and this disease, or get incredibly sick and try to navigate the healthcare system. There are also our essential workers. We have a lot of essential workers as well. And so there's a lot of work that we have to do. I'll keep my comments relatively short because I do want to take time for Q&A. But I will say, the healthcare disparities that have existed in communities of color, which include, of course, higher rates of asthma, diabetes, heart disease, did not happen by accident. They are the result of racism and systemic racism. And I often say they're results of times when people of color, especially Black people right here in the city of Boston, were explicitly told that because of their skin, they could not get a certain job. They couldn't live in a certain neighborhood. They couldn't attend a specific school. And as a result of this marginalization, exclusion, and oppression, these communities have suffered tremendous devastation, economic hardship, poverty, health disorders and diseases, and of course, lower life expectancy. And so all of these are being exacerbated by COVID-19. And so as we look to address and eradicate these inequities and to deal with the underlying root causes, it is absolutely important that we do it with a racial equity lens. There are a lot of folks who are talking about this colorblind approach. I've said it clearly, that is a total mistake. We use race to oppress people, and now when coming up with solutions to the problems, we have to now still bring that into the conversation. It's so incredibly important. And so a few things I've been working on, obviously the crisis standards of care, which I'm sure we'll talk more about. Councilor Arroyo and I held a hearing on that. This has to do with the state putting forth guidelines that said to certain hospitals that if we were to need ventilators or come into a space where we're short on ventilators and ICUs, that these guidelines would go into place. And there are folks at that table who said that we shouldn't use race when determining what those guidelines should be. We've pushed for expanding testing, particularly in certain neighborhoods. We've focused a lot on our essential workers, making sure they have PPE, of course, and housing if they test positive. And they have a lot of folks within their homes, that they have a place to go outside of their home to heal and recover so they don't affect their entire family. Hazard pay, other things that Marcelle was mentioning and working on, we continue to push for. One of the things I was most proud of doing as council president was securing external funding to bring the entire council through racial equity training. And I did that because I think all government leaders should absolutely be equipped to not only understand the complex historical context in the city of Boston that involves race, but to have tools to respond to it. We in government or policymakers often do not know that historical context, which is sad and often unsettling and disappointing. In order to put forth solutions to eradicate these inequities, we must meaningfully be trained and also have the tools. So did that as council president, and I'll continue to focus on. Come on, Alexander. And I'll continue to focus on, closing the racial wealth gap, the achievement gap, the schools, the lack of quality of schools in certain neighborhoods, and our impact on small businesses and economic opportunity, which of course are also being affected at this time. At some point you will see my 2-year-old, probably his face in this. I'm also a mother and a wife. That is a part of who I am, and a Christian woman. So all those roles show up everywhere I go, but happy and honored to be here, and of course to take questions. But there's still a lot of work to do. I want to thank many of the folks on the ground, including Priscilla Flint, who is leading the Black Boston COVID-19 Coalition, and others who are specifically focusing on communities of color. Kevin Peterson mentioned his town halls and of course his work as well. The folks are also on the ground organizing. They don't just understand the problem, they know the solutions. So look forward to working in partnership with them as well. Thank you very much.
Thank you so much, Andrea. We're going to hear from Marty Martinez, Chief of Mayor Walsh's Office of Health and Human Services. Go ahead, Marty.
Hi, Savina. Thank you. Nice to see you.
Thank you.
So thank you, everyone, and thank you for having me here today. And thank you for the organizations who put us together today, and our panelists, including Councilor Campbell and Mayor Morse. Thank you for your guys' leadership and continuing to do this important work in our community. So I thank you for what you're prioritizing and lifting up. You know, as the head of Health and Human Services for the city, it is our focus and goal to tackle COVID-19 in the way we need to, which is kind of down two approaches. And those two approaches are crisis response today, what we need to do today to help folks deal with the impact, not only on the physical health, but the health to the public around the many other issues that have been raised by our attempts to sort of limit and pull back on the health impact that's existed in the community. And then the second path has been to ensure that there's a pathway to recovery, a pathway to rejuvenate our communities as we are going down both paths. And there's been no question that for me personally, as the Chief of Health and Human Services, who helps to oversee the Boston Public Health Commission and our work across Health and Human Services, an equity lens and an understanding of the inequities that have existed is how you must look at this work and how you must try to tackle that work. And for me personally, and through the work through the city, we have tried to ensure that we understand what is the impact that we're seeing, what are we seeing on the ground, what are we seeing in our hospitals, what are we seeing in our food distribution sites, what are we seeing in the community when people are calling, what are we seeing in our long-term care facilities who've been devastated by the impact of COVID-19 on older Bostonians in our communities. And looking at all those pieces that we've seen and create strategies to ensure that we can tackle what we're seeing, but not forget that the inequities that existed that we're seeing in the data are not surprising. You know, the public health inequities that exist in data shows us that people of color are disproportionately impacted by many of the challenges that face our communities already. And when you take an infectious disease that spreads in a way that really tacks on to places that are dense, that impacts severely folks who have underlying health conditions, you expect to see what we have seen and the data that we've started to see, which is not surprising, but unacceptable. And to some of the data we heard Kevin speak of and Councilor Campbell and Marcelle speak of, we understand what is in front of us in data. Right now in the city of Boston, about 39% of cases of COVID-19 are in the Black African-American community, 23% are in the Latinx community. And both of those are over the percentage of the population that are represented in the city, both the Black African-American community and the Latino or Latinx community. And so we're seeing disproportionate impact in cases, and in deaths, we're seeing a disproportionate impact for the Black African-American community here in Massachusetts. And so what do we do about it? We can't just see it and accept it, we have to do something about it. So from the city's end, we've sort of tackled in a couple different ways how to look at what we're seeing and do some real work around it. And so as the health chief, what's been important to me is that we tackle based on access and based on impact. And so for access, it has to be to create access on the health side to testing, to tracing, to isolation and support, and getting people the care that they need. So that means looking at data, understanding what you're seeing, and then doing something about it. For me, it's always been about rolling up my sleeves to do something about it. So I want to give you just a quick example, and I want to be brief. But a quick example, we saw data early on that showed us in the community of Roxbury and Mattapan in East Boston, we were seeing high positive rates of people testing positive and low rates of people getting tested in general. So what did we do? We worked with our community health center partners, which are central to health in our community and our diverse communities. We helped support them, lift up testing so we could expand testing in those neighborhoods, and then looked at community messaging campaigns to get into those neighborhoods so folks could understand what did it mean to get tested, how can you get access to testing, and how do we ensure that you get care if you test positive for the coronavirus. And so what we were able to do in partnership with so many community leaders and advocates was help to bring down the positive test rate in all 3 of those neighborhoods. We were also able to boost the number of people getting tested in those neighborhoods so we could get people more access to care and support. And I only share that example that we're still in today. We're still rolling up our sleeves to figure out how to get people access to supports and resources so they can get the care that they need. But you have to look at the data and then you have to do something about it. So asking the questions is important and then doing the work when you see something that shows you there's an inequitable impact. So the testing's been on one side and thinking about recovery and the pathway's been the other. We created an inequities, a COVID-19 inequities task force, a health inequities task force, where we put leaders of color together to work with the city to advise us on what did we need to do differently, what did we need to hear, and how do we not go back, and I think it was Kevin's point, how do we not just go back to the inequities that existed, but how do we look at a different path forward so we're not recreating what's put us in the situations that we're in today. And I think that's a really important piece. There are limits of what we can do in government, but there are not limits on what we can do together. And so the task force or the work through city government has meant to try to understand what the gaps are, try to strengthen the approaches, and to make sure that when we think about recovery and we think about reopening, we don't forget that COVID-19 has had a disproportionate impact on the lives of communities of color. And that means when we recover and we rejuvenate, we have to remember that that impact has been disproportionate and that the path forward needs to look different for different communities. And I think that's a really important piece to keep in mind. So for the city, we've had to look both. We have to respond to crisis. We have to do today. My team works 7 days a week, most days, all day, to try to figure out strategies to support all Bostonians and to think about where we go in the future to tackle the inequities around healthcare that exist and the impact that COVID's had on our essential workers, the impact that COVID's had on our healthcare systems and our health professionals, and the impact that it's had on our families, whether it's school or food or the resources that have been now disproportionately impacting different communities. The last piece I'll leave you with is I think creating access to testing and care is a really important piece not to forget. And we have to think both big picture and transformational change. And we also have to think small picture. I go to my community health center, I get tested for coronavirus, I test positive, and now what do I do? We have to think both those lanes to really make sure that we tackle the disparities that exist and that we make sure that what's happening in our communities can be not only supported, but that people can have the access to what they need. As a resident of Dorchester myself, I live in Upham's Corner, I see my neighbors trying to figure out how to navigate these issues and challenges. And I'm proud to work with many of you to make sure that we don't just remember these inequities now when there's a pandemic and everyone's paying attention, and in 6 months we're on to the next thing, if that's really true, but that we don't forget the impact that's been with us now and the impact that will likely be with us moving forward. So thank you for having me, and I look forward to answering questions people might have.
Thank you, Marty. And lastly, we're going to hear from Alex Morse, the mayor of Holyoke. And after he's finished with his comments, what we're going to do is begin the Q&A. I'm starting to see some questions already in the chat box, but so let's hear from Alex Morse, again, Mayor of Holyoke.
Great, thank you, Savina, and thank you to everybody that put this event on. And it's an honor to be with fellow panelists, and thank you all for the work that you're doing in your respective organizations and communities. And I'm happy to represent the best I can the western part of the state this evening, and really appreciate the opportunity to talk about some obviously challenges that our residents here in Holyoke, but throughout Western Massachusetts are experiencing right now. And Hampden County, unfortunately, has the highest rate of death due to coronavirus of all counties in the state. And Holyoke, where I've been mayor over the last 9 years, is 50% Latino, mostly of Puerto Rican descent. 80% of our kids in our public schools are Latino. And, to Andrea's point before about sort of this colorblind attitude to public policy in general, we saw this several weeks ago when there was reticence from the State Department of Health and Human Services to even releasing city and town specific data, which didn't allow us to see where cases were and what communities were being most hard hit. And also in the system that we have to use, Maven with the state, it doesn't allow us to see racial or ethnic breakdown. And so there's some structural barriers to actually identifying disparities among race and neighborhood that the state has actually built into their reporting requirements. And so it's an important conversation for us to have around what kind of data infrastructure do we have at the state and federal level that allows us to even implement and develop public policy that's specific to the challenges that we face. And so that's point number one. And, as mayor, we've been through a lot over the last 9 years, but I don't think any of us have seen on the local level what we're seeing today, and a much larger point that a lot of mayors and local officials, and I imagine all of us, we particularly feel like many of us are on our own, given a lack of leadership, obviously at the federal level, but even to some extent at the state level. It was mayors and local communities that were making decisions about school closures and non-essential business closures and orders from local public health departments before we saw widespread policies put in place at the state or the federal level. And again, to the impact that this is having predominantly on Black and brown communities here in Western Mass, across the state and across the country, we're also seeing enforcement disproportionately impact communities of color when there's issuance of fines or arrests based on who's social distancing and who's not. And unfortunately, none of us should be surprised as to the disparities we're seeing in our communities, given that these disparities aren't new. It's just shining an additional light on the divisions that have existed in our communities for some time, where we relegate certain people to go to school, where we relegate certain people to live, and therefore the air that they're breathing or the water that they're drinking. And that's certainly the case here in the Springfield and in the Holyoke area. As a mayor, we've seen this. We sort of mapped this out in 3 different phases. Number one, doing everything we can to save people's lives and keep people alive and well informed. Number 2, mitigating the impact, which is an ongoing effort, particularly protecting and mitigating the impact on the most vulnerable members of our community. And then number 3, what does a just recovery look like for our city, for our region, and for our country? And in the mitigation of the impact, we already are in a community with a high percentage of folks that are food insecure and housing insecure. And so, we've had to make sure that we provide meals. I mean, we've distributed 15,000 meals just over the last several weeks alone. And, one point in particular that's been a challenge here in the city is access to internet. As we expect kids to learn remotely at home, not every family or child has a device at home or has internet at home. And so we had to step up and pass out 1,500 devices and laptops to kids that don't have them at home. And we had to invest and provide internet for the next 6 months to hundreds of families that didn't have it at home for the next 6 months. And so those are investments that the city has had to make, given, again, the digital divide and predominantly, again, low-income families and families of color that just frankly didn't have access to that technology or communication or connectivity to their teacher, to their family members, and to their friends. And so those are some of the things that we've been working on. I'll also say, nearly 70% of our cases here in Holyoke are long-term care facilities. We had one of the nation's worst outbreaks in a veterans facility here in Holyoke at the Holyoke Soldiers Home, which was really a failure of leadership from the top on down. And the elderly, the poor, the sick are not disposable demographics in our community. And too often, we hear, well, they had underlying health conditions. And again, as was said before, underlying health conditions aren't an accident. Those conditions are there because policymakers made specific decisions that led to those health outcomes in the first place. And as we see nationally, this, what I perceive to be a swift reopening of the economy, wherein coronavirus hasn't gone anywhere, predominantly white policymakers are making decisions well knowing that as we open the economy, it's going to be poor folks and communities of color that are going to continue to get coronavirus at a disproportionate rate and impact. And so we can't allow for others to continue to move in one direction without continuing to remind people who this is impacting the most. And then just our local economy and the economy across the state. We know that, again, communities of color are frontline workers in our community that are getting exposed to this virus. They're working at the grocery store, they're driving the bus, they're serving food, while other folks are making decisions that put them at risk. And so continuing to make sure we pay people, that we protect people, that we compensate people for their time and for the work that they're doing each and every day is incredibly important. And we can't let this virus pass as if it's just a season beyond us. And we have to make sure we continue to honor these workers and the impact this is going to have in the long term. And I'll just close by saying this is obviously impacting folks' physical health and financial health, but it's also impacting people's mental health and emotional well-being. In a community where a vast majority of our students experience trauma in so many different levels of their lives, we in Holyoke are seeing one of the biggest psychiatric inpatient hospitals close all of their inpatient psychiatric beds in the middle of a global pandemic where people and kids are going to need access to mental health services now more than ever. And traumatic events will continue to happen. It was 2 nights ago that we had a microburst displace over 110 residents in one of our poorest neighborhoods in the city. And I will say just the resilience of our people and our families has been nothing short of humbling amidst not only amidst this pandemic, but amidst folks being displaced from their one source of comfort and security, their home. And I think a lot of folks are obviously relying on us as leaders in our community to make sure that we craft very specific policies that address and meet people where they're at, and don't assume that all folks are coming from the same playing field. And this language around we're all in this together, well, many folks don't see it that way, that don't have access or the privilege that many of us have. And so again, I just appreciate the opportunity to shine a light on our Holyoke experience and Western Mass experience, and really honor and thank all of you for the work you're doing in your communities.
Thank you so much, Alex. And so before I wrap up, I just want to iterate that to all of the attendees, please add your questions, and I see them coming up now in the Q&A box, okay? So that would, let's see, I think 1, 2. Okay. I believe that Brian Garvey is going to handle the questions. So I want to thank all of the participants in the 4th Fund Healthcare, Not Warfare series. And I'd also like to thank all the co-sponsors and also Rosemary Keene, who is the co-chair of Mass Peace Action, for organizing this wonderful panel. So we're going to wrap it up, and let's just have these final words by knowing that folks on the ground, in particular, everyone that's here, and all of the co-sponsors for many, many decades have been on the ground ringing the bell around all the systemic issues and inequities that have plagued our society for many, many years and impacted the most poor and dispossessed workers, healthcare workers, low-wage workers, moms, dads, teachers, and everybody on the ground now that's showing up to do the work that literally has not been done. And it's obvious that we've got a lot of work to do. We've got a lot of work to do. This is going to be difficult, it's uncomfortable, but imagine poverty being uncomfortable every day. So let's just adjust our lens, right? And suit up. This is a hard run. We've never been here before. And as a United States veteran, I do see the social and economic impacts of war every single day. And we have to treat this with the same traumas that we're going to see coming out of this. So let's not forget to provide the mental health resources, the housing, and the expansion of healthcare as we move forward in our communities. So again, thank you so much for your participation, and we'll begin with all the questions, and the panelists can feel free and answer as long as we have time. Cole?
Thanks so much, Savina, for moderating.
Oh, thank you, Brian.
And I'll be fielding questions. And if you have a question for one of our panelists, please use the Q&A tab, which is right in the center at the bottom of your screen. But I'm just going to jump right into it so we can get to as many of these questions as possible. This first one is for Claire. It's from Claire, and it's for Marty Martinez and Councilor Campbell. Many factors contribute to the disproportionate impact on communities of color. Inadequate access to housing that is truly affordable, especially for lower income folks, and this leads to more crowded units. Even moderate income folks are finding it hard to pay rents or to buy the things that they need. How will the city's new reality take this into account moving forward?
Thank you, Brian, and thank you, Claire, for the question. And I have to do a quick shout out to my constituent, Rosemary, too, for being a part of this as well. So thank you, Rosemary. So obviously, the housing issue is another example of the issues that have been facing the city of Boston before COVID-19, right? We had a housing affordability issue for some time, people being displaced, gentrification, all very much real issues. A few things, I think some of this work has started already and will continue. One example is the Community Preservation Act. So in my first term on the council, I pushed with Councilor Flaherty for passage of that. And it has created a new source of revenue, not only to build more affordable housing, both rental and home ownership opportunities, but as well as historic preservation and creating more green space in our communities. And just recently, we had a very robust city council hearing on dishing out millions of dollars for those projects, including for affordable housing projects. So very proud of that. We continue to push for, well, I continue to push for us to be extremely intentional. And I think what I mean by that is extremely intentional in terms of certain neighborhoods. We can map it out where folks are being displaced, where rents are incredibly high. It exists across the city, but I think in certain neighborhoods, Dorchester, Mattapan, and Roxbury, those neighborhoods, you see families that have lived in the city for a long time being unable to afford the city of Boston. We see those who have come from our universities and want to stay here, unable to afford to stay here. We see folks who born and raised in the city of Boston, left to go to college, coming back, can't afford to stay. So in addition to pushing developers in the city to make sure that these units that are coming online are absolutely affordable, I think we can get really creative. And a couple of creative ideas we've been working on specifically in my district is we call it the Vacant Lot Project. There are a lot of city-owned vacant lots in the city of Boston. Disproportionately in my district, we even have inequities around vacant lots. But pushing to activate those lots, to get those into the hands of folks who can develop them quickly for home ownership opportunities or rental opportunities, for intergenerational housing, creative things like that we're pushing for. And lastly, I'll say, I believe that government has some solutions, but the community also has solutions. And I'll give you one example. I live in Mattapan, and how we bought our house, there was a woman who'd lived here for 40 years, and she wanted to move to Florida after that last horrific snowstorm years ago, but she wanted to sell it to a young couple who was starting a family who lived in the city. And so we went lawyer to lawyer, and we made it happen. So you have seniors and older residents thinking really creatively around how they keep their housing stock, their asset in the community to help a family that could be displaced, or to help someone who's facing gentrification or facing or neighborhoods facing gentrification. So there are communities and residents doing really creative things in the housing front. I think we need to think about how we empower those folks to be even more creative.
Thanks. I'm going to move on to the next question, just in the interest of time. This is from Nancy. It says, even before the COVID-19 crisis, there were long waiting lists for mental health services at agencies providing, sorry, my screen just switched from the question. My apologies. Okay. at agencies providing clinical services to low-income people. This one was also addressed to Marty and Andrea, but since you mentioned mental health in your talk, I wonder if you could take that one out.
Yeah, I mentioned this earlier. We when students are in school, they have easier access to clinicians. We have pretty robust partnerships with social workers and counselors and River Valley Counseling here in Western Mass. But what we're finding is not only the trauma of this pandemic, but trauma that existed long before this pandemic, needs are going unmet. And in the middle of this crisis, the manifestation of this crisis and who it's affecting, I mean, our healthcare system is completely broken. We have a system that's designed to maximize profit, not to actually provide healthcare and keep people alive. And low-income communities, folks here in Holyoke, already have limited access to primary care providers, general health care. We rely on community-based health centers and neighborhood clinics. And again, Providence Hospital, subsidiary of Trinity Health, is laying off over 200 employees and closing the only child psychiatric beds in the entire area of Western Massachusetts, which is a complete travesty in the middle of this pandemic. And so, we're reading about all of this federal aid going to hospitals and to states and to local communities. Well, it's not coming to the community that I certainly oversee. It's not helping our Holyoke Medical Center, the last community hospital in the state. It's not helping Providence Hospital, the only psychiatric inpatient hospital in Western Massachusetts. And so, instead, this money is going to help the same communities, the wealthy corporations, the top 1% that always get help. And here on the ground, as counselors, as mayors, as people that work with like everyday people that are actually struggling right now, we're left with nothing and limited resources. And our country seems to have money for other things, but we just don't seem to have money for the things that actually will make a difference in people's lives. And mental health, the trauma, even the entrepreneurs and small business owners, these are business owners that are trying to build wealth for themselves and for their families. And they were already on the fringes with challenges being able to start their business in the first place. And this pandemic, I mean, the Paycheck Protection Program, at least here in Holyoke, small business owner after small business owner, talking about, they're yet to see any assistance. And so I think we just need to have a conversation. I mean, we can't rely on the federal government, apparently. And so what can we do as communities or a state government to do what we can to help the folks most in need?
Thanks, Alex. I'm going to keep it going here. I think this is a good question for Marcelle. This is from Mike H. He says that he has participated in lots of these Zoom meetings, attended a small protest at the South End Jail, participated in car rallies. He says he's testified numerous times at school committee meetings, but he says Corona has limited the tools that we have to participate in the political process. What steps do we need to take to escalate our fight for what we need and to fight against current injustice and the upcoming increased austerity that he expects?
Thank you. Thank you for that question, Mike. It's a really good question, which if we had a longer meeting, I would be able to answer it fairly. But I'll say that, yes, this pandemic right now has definitely limited the types of things that we can do. But I also like to think about how the folks that we can actually reach and organize and the pool of folks we can reach has expanded because so many people are impacted in so many different ways by the pandemic. So if anything, now is definitely an opportunity, whether it be union organizing, community organizing, pushing up aggressive electoral policy, et cetera. Now is the time to do so. So I think that thinking about it that way is really helpful. As well as really trying to think about what it means to have a short-term strategy, a medium strategy, and a long-term strategy. I'm seeing a lot of different groups do really exciting actions and different events, as you mentioned in your question. But I think also as organizers and folks who love justice, we need to think about what does this moment mean for us right now for our strategy? What are we doing in the medium term, and also what's the long term? How are we going to build a new normal that's actually fair in the type of policies and world that we deserve? So I would say, going back to your organizations and community, really think about the different approaches to strategy that you can take.
Thanks, Marcelle. This next question is for you, Kevin. It is from Jeff out in Worcester. He asks, how do we change the narrative of false patriotism, which promotes the military, worships the flag, distorts the gospel, and longs for the good old days of white supremacy? How do we change that narrative to we're all God's children, we're all in this together, and the real message of the gospel that Jesus teaches is to love one another. He says it's no easy thing to do, but how do we initiate this huge cultural shift that we so obviously need? Oh no, it looks like we lost Kevin. My apologies. I will move on to the next question unless someone feels that they would want to take that one.
Maybe Savina would take it.
Thank you, Cole, for nominating me. The Poor People's Campaign, a national call for moral revival, speaks about the 5 evils, 3 of which Reverend Dr. King so eloquently laid out, which was systemic poverty, militarism, and the war economy and poverty. So the Poor People's Campaign added the last 2, which you see in our documented work, which is ecological devastation and white Christian nationalism. And we believe that we do have to change the narrative and hold faith leaders accountable to that. Let me give you a quick example. An example is in Isaiah 10, I guess 1 through 3, perhaps, it speaks about who are you, right, to legislate these types of policies and laws that deem the widow and orphan, penniless. In other words, these violent legislatures or laws, I'm getting tired, so excuse me. These laws that are written that prevent us, the poor, from having access needs to be dismantled. Let me say it that way. It is in the Bible, it's written in the scripture. How dare we blame the poor for their poverty, right? I mean, and we can go on and on and on if some of the Bible scholars want to, do an exegesis on the Bible. But, it speaks about the poor. We're seeing it playing out with the rallies that Trump is calling out, right? We're seeing people every day talking about Christianity, guns, right? Christianity, guns, and God. But I think you all know exactly where I'm going. I could just go on, but it's just not, we don't have enough time to do that. But that's a whole nother conversation about shifting the moral narrative. What we're seeing right now is a moral that's going on across this country, right? How dare we have people sleeping in the doorways in the subway station and mothers and fathers working 2 and 3 jobs and can't even afford health care. They're 1 paycheck away from homelessness. So, what's going on in this country is totally immoral, and it goes against quote unquote Christian values. So we have to together shift the moral narrative and change this country and dismantle these policies and the system of capitalism that perpetuates these social ills that we see.
Thanks, Savina. I know we're running a little long on time, but I did want to ask one final question. I'll give this one to Marty. It's an important one. As over 5,700 people have died from COVID-19 in Massachusetts and The numbers do not clearly show a downward trend. Local and national experts agree that Massachusetts does not meet the criteria for reopening, yet it appears that Governor Baker is going to announce reopening tomorrow. Is it too early to reopen Massachusetts in your opinion?
Yeah, so thanks for that. Yeah, I mean, I think, you know, in all situations, you know, across the country, governors sort of lead that part of thinking about how things open up and how things will progress, and that's true here. The governor will announce tomorrow some loosening of restrictions and things will start to open with some timelines. But let me be clear from the city's end and from Mayor Walsh's end, we must be cautious. You know, we still have cases. I think, you know, we had 100 cases today with 7 deaths that were reported to us today. And so we have to be cautious. In a pathway to recovery and reopen, you have to remember that not all pathways are created equal. And the disproportionate impact that people are experiencing will only be heightened as we start to open up things. So are we moving quickly? I think we're moving probably quicker than I might. But the city is also clear that we're going to move based on Boston-based data and what it says in Boston. And the mayor's been clear about that, and we're going to make sure we keep Boston's folks a priority in this situation. So those are my thoughts.
Thanks, Marty. I see that Andrea would like to say a couple of words on that subject as well.
And I'll be quick. We've been having conversations about the reopening, and I do think, you know, it has not been, the fact that an announcement is coming tomorrow and I know very little, I think is very troubling. And we're in the system, right? And so I want folks to always put their health first. We still have a lot of testing to do. I think Chief Martinez, often we're talking about the need to test people who are asymptomatic because you could still be a carrier. I have 2 young children, a 2-year-old, as you saw earlier, and a 5-month-old. And there's more information coming out about children that is very concerning. So I don't want to create a sense of fear, but I do want folks to remind themselves that we are in a pandemic. Safety in your health is most important. No one, I think, will look out for you better than hopefully yourself, right? So I think we just have to be very mindful. We're still raising questions around adequate testing, the childcare situation that people are talking about, big deal. Equity in the reopening conversation, what that looks like, that intentionality. So still a lot of questions there. And so I urge people to sort of continue to ask the tough questions to the governor and his task force with respect to this. But I do think they're moving a little swiftly here, and to just want to raise up the fact that it's important that you take care of your health. Thank you, guys. And thanks for hosting.
Thanks so much, Andrea. Just want to say a few words to wrap things up. I just want to let, well, first of all, let me thank all our wonderful panelists. Again, thank you so much for taking the time to join us and speak to the audience, and to all the attendees for tuning in. Savina, you for moderating, and Cole and Rosemary for your efforts in organizing this great program of the ongoing campaign, Fund Healthcare, Not Warfare. I want to let everyone know that a recording of this program will be sent to you in a follow-up email. We encourage everyone to please share with your friends and contacts. We need to get the word out about this important work that's been being done. Cole has just put up a petition. We will link to this as well. We will be sending this out to your representatives, demanding that spend money here at home instead of more money on our already bloated military budget. But we know that there's dramatic racial inequality in our country and across the Commonwealth of Massachusetts as well. We see that the consequences of our militarism overseas affects people of color more so than others. And we see that same effect here at home. So racial justice is a peace issue. It really speaks to the intersectionality of all the progressive issues that we are working on. And that's something that we here at Massachusetts Peace Action strongly believe in. that the only way that we're going to achieve our goals is by standing together, shoulder to shoulder, as a progressive movement, making these demands together. It's really what intersectionality is all about for us. So I want to thank everyone for joining us today, and thank everyone for your work and for your activism to push this forward. It's what we're learning from this pandemic, is that we need to fund healthcare, not warfare, and support the needs of the people right here in this country, especially the most vulnerable communities. So thank you all for tuning in, and please stay in touch. You can always reach us, info@masspeaceaction.org. We would love to hear from you, and all of our webinars can be found at the Mass Peace Action YouTube page. Thank you so much for being with us, and we hope to talk to you soon.
Thank you all.
Thank
Peace to
you all.
of you.
Bye-bye.
Bye.